Welcome, everyone. All right, I'm going to be talking about my research project, which I titled Examining Differences in Housing Voucher Application in Cook and DuPage Counties. So, a little bit of background about the program that I work in. It is dealing with cases from Department of Children and Family Services, which is known as DCFS. And so, in instances of reported abuse and neglect, Illinois assigns the Department of Children and Family Services to investigate and manage these cases. In cases where reunification or intact, which means children with parent, is the goal, the parents must complete a program with mandated aspects like substance abuse counseling, anger management, job training, and so on. So housing is one of the pieces of that and can mostly come towards the end of the program, which lasts up to 2 years for them, or can come right away if there is an immediate need. So the DCFS case manager alerts the client to this program and gives them a little bit of information about it, and then they get forwarded to us, and from there we continue. So housing that meets occupancy regulations and passes inspection is the last piece in these cases. So in order for the client to start home visits with their children, they need to have a stable place to live that is approved by DCFS. So this program is done at La Casa Norte, which is located in Humboldt Park and was established in 2002. The Housing Advocacy Program, otherwise known as HAP, works with referrals directly provided by DCFS with 7 full-time advocates that handle 15 to 25 cases each. They're a little short right now, so there's roughly about 150 cases that are open, and they've had a couple of people leave, so they're not running at full capacity right now. The Housing Advocacy Program works directly with those involved with DCFS to help them obtain housing, make budgets, furnish their homes, and obtain household items. HAP works with a fund that provides $2,500 for these moving expenses, which are otherwise referred to as Norman funds. So in my training, I was pretty struck by the differences in housing law application between Cook and DuPage counties, which ultimately follow the federal laws that are set forth by the Department of Housing and Urban Development, or otherwise known as HUD. So the fact that they are interpreted differently, it was really kind of like raised my eyebrow a little bit, because we were told by the case manager in our training that like it gets really complicated once you get out to DuPage, like they have their own rules and so on and so forth. So I was like, okay, well, there's got to be something in there to study. So brought me to the research questions. The first being, do the differences in housing laws in Cook and DuPage counties result in discrimination towards participants in the DCFS Housing Advocacy Program? And do these differences disproportionately affect single women of color with low incomes, as that's something I was noticing in terms of the client makeup? For my literature review, I focused on a couple of main things that jumped out to me. One being housing outcomes on health and equity. There are 4 main factors affecting health and equity in terms of housing, and that being stability, affordability, quality, and safety. There's also shown to be improved health and psychological well-being associated with housing assistance, and many assistance programs do require participants to move to opportunity areas. This is typically in the case of a voucher. So if someone were to obtain a voucher and they live in an impoverished area that's like high crime, part of the requirements of that voucher is that it's only good in certain areas. So an opportunity area is typically considered a place where there is greater economic opportunity, better schools, less crime, nicer rentals, so on and so forth. Another main component of this is obviously DCFS involvement. So housing deemed inadequate or unstable contributes to 2 major troubling findings, that being, 1, that there are higher levels of out-of-home placement during case involvement, which I would say we see in the Housing Advocacy Program. And there is a greater need for housing assistance after case closure. So even after they go through this program and their cases are closed, there is still a need for assistance. So this program is effective, hopefully, in teaching the clients skills that they can use even after the case is closed, and that it's just like building resources for them. Another main thing is that youth aging out of foster care do experience difficult transitions to many adulthood-related activities. So for a lot of the youth clients, they've never lived in a place that was their own. They've never had a job. They don't know how to talk to landlords. They don't have any savings. They really don't know what monthly adult responsibilities are like. So this program really assists them in also building resources and knowledge for them to be able to live on their own. I didn't end up really involving any youth clients, but that was, a potential part and something that I wanted to prepare for. So progress has been made to improve housing equity and opportunity in Chicago and Cook counties, but research does suggest that certain methods of housing discrimination have been transferred to the suburban counties that surround Chicago, DuPage being one of those. Governmental messaging has proven effective in the reduction of housing-based discrimination and does need to be more effectively enforced. Studies also show that many families do not end up using housing vouchers and often end up in more poverty-stricken areas. So when those requirements, once someone gets a voucher and the requirement is that they need to move to a completely different area where they may have no family, there's not a quality public transportation system, or it's too far from their jobs, like oftentimes that they just don't want the voucher because they don't like the stipulations that are attached to them. In terms of my data and sampling, I focused on secondhand data for this study, so all the cases were closed and the physical case files are kept on site for 6 years after case closure at La Casa Norte. I also used a mixture of quota and convenience sampling for this study. So I used 17 cases each from both Cook and DuPage. I also, used the closed cases to have a more accurate picture of the before, or like the initial experience into the program, and then the after regarding participation in the program. So for my key measures, in terms of continuous variables, I used age, number of children, income level, and then I had hoped to do credit score initially when I set this up, and I did have it for some, but I did not get it for all, so I didn't end up using it in the study, just because I didn't have a complete data set. For categorical variables, I measured race, gender, marital status, employment status, housing history, which was specifically targeted towards a history of eviction, if there was an eviction on the client's record, whether they were Norman or youth class, whether they resided in Cook or DuPage County, if they had history as a survivor of domestic violence, if they were rejected in the housing application process, and if they possessed a voucher for subsidized housing. My hypothesis was that I believe that the participants in DuPage County experience more discrimination in their search for housing than do the participants in Cook County. I also believe that housing discrimination experienced leads to negative social outcomes for the participants. In terms of my results, all 34 cases, 100% of the total, were of Norman class, which meant families, so I did not have any youth clients, and that was totally random. I did expect to see at least one or two. I chose 17 cases each from Cook and DuPage. 33 of the clients, so 97% of the total, were female, and one client, roughly 3%, were male. So very skewed towards female clients. 6 of these clients, which is roughly 17.5%, were white. 13 clients, or 38%, were black. 10 clients, which is about 29%, were Latin. 4 clients, roughly 12% of the total, were identified as Black and Hispanic. And 1 client, roughly 3% of the total, was Asian. So that makes for 28 clients, or 82% of the total, as non-white, which is very skewed towards people of color. 32 of these clients, 34%, or rather 94% of the total, are single versus 2 clients, which is roughly 6% of the total, that are married. So again, skewed towards single as well. 15 of these cases had 1 or 2 children, which is 44.1% of the total. and then 19 cases, which is roughly 56, have 3 or more children. I grouped those together that way because of the occupancy regulations for DCFS. So once we get to 3 or more children, you definitely need a minimum 2-bedroom, but preferably 3 or more. So again, the need for more income. 7 of the cases, roughly 20.6%, were homeless. 14 cases, 41%, are unstably housed, and 13 cases, which is 38.2%, were not homeless and stably housed. So 61.8% of these cases were experiencing some form of housing instability. 9 of the cases, which is 26.5% of the total, had evictions on their records, and 25 cases, which is 73.5% of the total, had no history of eviction. So that was kind of like a plus. 21 of these clients, which is roughly 62% of the total, were employed versus 13 cases at 38% that were not. 20 clients, which is roughly 59% of the total, were rejected after applying for housing versus 14 or 41% that had not been rejected at all. In terms of the survivors of domestic violence, that ended up being roughly 3/4 of the population, which was 25 clients or 73.5%. The mean age of the clients was 32.29 years of age, so 22 was the youngest, 48 was the oldest client. Mean income level is $1299.85 per month. So that meant 27 of these cases, which was roughly 79%, that earn $2,000 or less, which is below the federal poverty line. So the mean length of time spent in the program was 11.85 months. In terms of my inferential results, I ran an independent samples t-test that used the county grouping, Cook and DuPage as a grouping variable, and ran this against their likelihood of being rejected for an apartment after applying. And that test produced a SIG value of 0.004, which shows a significant statistical significance that clients in DuPage County face a higher rate of discrimination in the housing process. So once I broke it down to county level, it was 14 of the 17 clients, or 82.3% in DuPage, that faced at least one rejection after applying for housing, whereas Cook County clients were rejected in only 6 of 17 cases, or 35.2%. So that is more than twice as likely in DuPage to be rejected versus Cook. So therefore, the results of this t-test fail to reject the null hypothesis, that there is no statistical difference between clients in Cook and DuPage County in relation to facing discrimination in the housing process. So an overwhelming majority of these cases involve single women of color, so 94% single, 97% women, and 82% of color. And then a majority also are below the federal poverty line, have 3 or more children. So yeah, those numbers just kind of jump out. And then additionally, 62% are either homeless or unstably housed. Main research hypothesis here was confirmed by the t-test, but is pretty easy to see when looking at the raw data. The results here suggest that Cook County's law prohibiting landlords from refusing clients based on voucher participation or cash assistance programs is effective. DuPage County should amend or change their law outright to protect vulnerable populations in need of housing, which would effectively end the continuation of these racist, like black belt and redlining practices that have transferred from the city to the surrounding suburban counties. In terms of my limitations and conclusions here, I had hoped to have credit score to use that to find correlation against rejection, and I just didn't have it. So I'd also hoped to have a total of 50 or more cases, but there just wasn't enough cases from DuPage County, as they had kind of recently started working with them in the last couple of years. I would have liked to have interviewed the participants as well, just to have kind of a really complete picture and ask about their specific experiences, but I just couldn't do that. The results of this study do point to a troubling trend in DuPage that, kind of discourages people from residing there, and an alarmingly high number of single women who are extremely poor, survivors of domestic violence, and have 3 or more children with little stability in their living situation do make up this population. So that will do it. Thank you so much.